Hi, I'm Dr. Kelly Starrett with the Ready State, and I'm asked often, should I use my H-wave before surgery or should I wait till start to use it after the surgery? And we are big fans of integrating this amazing technology into my pre-surgical process for a few reasons. Number one, the more comfortable I can get with pad placement, understanding how to use high frequency and low frequency, how I can adjust positions of the pads to have different outcomes of muscle recruitment, all of that makes it effortless to engage with brand new technology when I'm in a little bit more of a threatened post-surgical state. So absolutely, just get comfortable with it, start using it, start to feel how simple it is to integrate this extraordinary technology into sort of your pre-game process, because it's going to be a lot easier when you get home from the hospital. Number two, we're trying to keep as much muscle mass on the athlete as on the patient as we possibly can. And an inhibited musculature system, a system that's swollen and congested, doesn't move, and that inhibition that begins when I have a big swollen joint or a big swollen tissue system often leads to a real quick disuse atrophy. So the earlier I can get that muscle recruited, that neuromuscular recruitment drives a lot of protective mechanisms that keeps me from losing this mass. So I'm worried about having a quad smaller than the other quad, or keeping my muscle the same on both sides, or just maintaining function, keeping the leg plugged into the system makes a big difference. Three is that a surgeon is going to want to work on a tissue system that isn't highly inflamed and very swollen. Oftentimes we hear that someone says, hey, I went and saw my surgeon, but she wants to see me in 2 or 3 weeks once the swelling has come down. And in those situations, I'm like, good, give me 24 hours. We can get ahead of this swelling. Which means that if we think about surgery as sort of controlled chaos, controlled trauma, the sort of more we can control some of those factors going into that, because I have a system that's comfortable with movement, a system that's got under good pain control, and a system that isn't congested, that means that the surgeon is going to have a lot easier job doing her thing. And we're not automatically loading up more trauma on a system that's already traumatized. So whenever we can get that tissue moving again, remember, H-wave is really just a movement device. It's a lot of movement without motion of the actual limb. I can keep that brain plugged into the tissue system, I can manage that congestion, and I can begin to think about, hey, I can actually get off some of this pain medication that I'm using to manage this post-trauma issue before going to surgery. Those are all win-win-win-wins. So the bottom line, should you get your H-wave before surgery? Yes, as early as you can, as often as you can, because it's only going to set you up for success on the other side.